Little is known of the life of Homer, the author credited with composing the Odyssey, one of the most influential epic poems of the Western world. It is certain that the text we know today was not written down upon its initial creation, for in the 8th century BC, Greek written text had been largely forgotten. Instead, the original poem was composed in an oral tradition and was more likely intended to be heard rather than read. However, here at Sketchy, you know we do our research. We've dug up the original story, in fact. As Homer originally intended, it turns out, though let me remind you this is highly debated by modern scholars, that the entire poem is one big metaphor for cancer chemotherapy. Specifically, the alkylating agents, anti-neoplastic drugs that exert their cytotoxic effects through the transfer of an alkyl group to DNA. Let me give you a brief synopsis of this alkylating odyssey. See Odysseus here? It's the beginning of his long journey home to Ithaca following the fall of Troy. After a pretty uneventful encounter with the Lotus Eaters, who, let's face it, are just a bunch of ancient Greek hippies, Odysseus and his men are soon captured by the Cyclops Polyphemus, here to represent our first alkylating agent, cyclophosphamide, which is one of the most widely used alkylating agents. Cyclophosphamide works by attaching an alkyl group to the guanine base of DNA at the number 7 nitrogen atom specifically. This interferes with DNA replication by forming intra-strand and inter-strand DNA crosslinks. It's kind of like these cross-linking chains here that Odysseus and his men attached to the Cyclops moments before he awoke from his slumber. They've alkylated his ankles, if you will, before making their escape. The alkylating action of cyclophosphamide is cell cycle phase non-specific. Cell division is brought to a halt and the cell undergoes apoptosis. In reality, cyclophosphamide is a prodrug. Before it takes effect, it must first be metabolized into its active form by the cytochrome P450 enzyme system in the liver. At Sketchy, we represent cytochrome metabolism with our recurring CYP450 license plate attached to a chrome bumper. Kind of like this one here attached to the chariot commandeered by one of Odysseus's men as they flee the island. And what better way to activate a sleeping Cyclops than a few well-placed javelins to that eye of his? Once activated, the cross-linking action can take effect, and down goes the Cyclops. As Odysseus hastily sets sail, notice the cancer crab design that we've incorporated into the ship. Torn to remind you that we're bringing those rapidly dividing cancer cells to a halt, though active drug enters normal tissues as well. Cyclophosphamide is used to treat a variety of cancers, including leukemias and lymphomas, as well as solid tumors such as breast cancer and ovarian cancer. Cyclophosphamide is also one of the most potent immunosuppressive therapies available. Take a look at these antibody-evoking lanterns hanging from the mast, torn in order to evoke an image of immunosuppression. That's right, neoplastic cells aren't the only rapidly dividing cells targeted by this alkylating agent. Cyclophosphamide also effectively inhibits the proliferation of immune cells and therefore can be used to treat severe autoimmune and inflammatory conditions. Things like nephrotic and nephritic syndromes, vasculitis, and autoimmune hemolytic anemia. Although very effective in the treatment of rheumatic diseases, cyclophosphamide has the potential for devastating toxicity both in the short and long term, so its use is limited to patients with the most severe disease. One of the most serious short-term adverse effects of cyclophosphamide relates to the induction of cytopenias secondary to myelosuppression. Just take a look at the marrow spilling out of that bone bludgeon wielded by our enraged Cyclops over here. In order to prevent a potentially dangerous bone marrow toxicity, patients treated with daily cyclophosphamide should have complete blood counts checked every few weeks for as long as they receive the medication. Psh, silly Cyclops, you have no depth perception. What are you doing? You gotta reassess your life, man. You're the son of Poseidon, and now this? What happened to you? And I have to say, the decor on your island, my friend, it needs some work. I mean, when was the last time that fountain was cleaned? It's got some kind of plume or something. For all of you sketchy veterans out there, a fountain peeing blood can only mean one thing. That's right, hemorrhagic cystitis. Cyclophosphamide is metabolized by the kidneys into a molecule called acrolein, which is then excreted in the urine. However, it turns out that acrolein is toxic to uroepithelial cells and can cause cell death and necrosis if allowed to be in contact with these cells for a prolonged period of time. So, just keep cyclophosphamide cystitis in mind when that patient with an extensive history of chemotherapy presents with dysuria, urinary frequency urgency, and progressive hematuria. Hemorrhagic cystitis can actually be prevented with aggressive hydration and the co-administration of 2-mercaptoethane sulfonate, or MESNA, which is a sulfhydryl compound that binds and inactivates the toxic metabolites. Think of it as this MESNA maze, preventing travelers from reaching that hematuric fountain. The bladder toxicity associated with cyclophosphamide doesn't stop there, though. Do you see that big golden cancer crab belt buckle sported by our furious yet fashionable Cyclops? It turns out that cyclophosphamide confers an increased and likely dose-dependent risk of bladder cancer, usually a high-grade transitional cell carcinoma. And this increased risk persists for years after discontinuation of the drug. Cyclophosphamide can also induce hyponatremia due to the syndrome of inappropriate antidiuretic hormone, or SIADH. And if Polyphemus weren't already the laughingstock of the giant community, Odysseus and his friends had one last prank to pull on our dim-witted Cyclops. The old water bucket on the head gag. Classic Odysseus. First it was the "hey, my name is nobody" prank, and now this? So much win! Marked water retention and potentially fatal hyponatremia can result, so watch out. Cyclophosphamide is also toxic to both ovaries and testes. In women, cumulative toxicity may even lead to infertility and premature menopause. Just look at this gnarly uterus of a tree here, dropping rotting fruit. Eerily reminiscent of premature ovarian failure, if you ask me. In men, cyclophosphamide can cause a decrease in sperm count and, with higher doses or duration of therapy, irreversible azoospermia. Alright, on with the adventure. After escaping the Cyclops, Odysseus and his men met this dude Aeolus, the windbag king, who gave Odysseus a bag of winds, except the sailor opened the bag early and went backwards, and the most tasty of his men were eaten by cannibals, while the rest were soon turned into swine. Then Odysseus killed himself, I think, and saw all kinds of famous dead guys like Achilles, who just whined about how being dead sucks. And then Odysseus and his men skirted the island of the Sirens. Our next alkylating agent, busulfan, will be embodied by the beautiful sirens, as they sing their enchanting song beckoning the passing sailors to steer toward those dangerous rocks. Like cyclophosphamide, busulfan is an alkylating agent. It forms DNA intra-strand crosslinks, which prevents DNA replication and leads to apoptosis of the cell. Busulfan is used as a conditioning agent prior to bone marrow transplantation, especially in leukemias, lymphomas, and myeloproliferative disorders. In other words, it severely depletes the bone marrow, hence the marrow spilling forth from these remains here. That sweet siren song, so intoxicating. Must steer toward attractive and possibly vagrant island women. What? Oh, thanks for snapping me out of that. Where was I? Oh, yeah. You see those golden chest plates engraved with that infiltrating lung pattern? Busulfan is associated with lung toxicity, which can manifest as acute lung injury, chronic interstitial fibrosis, and alveolar hemorrhage. Busulfan can also cause a generalized skin darkening, the so-called busulfan tan. They do just kind of sit out in the sun all day. Probably should put on some, SPF 60 or something. Alright, one last stop before Odysseus and his men reach Ithaca. It's the island of the centaurs. The nitrosauria centaurs, that is. What? You don't remember this chapter? Oh, you're saying I'm just completely making this up? Hey, Basilius Bessarion, who's telling the story here, huh? You or me? Like the rest of the agents in this sketch, the nitrosoureas are alkylating agents. They work by forming DNA crosslinks, which prevents DNA replication and leads to apoptosis of the cell. Most of the nitrosoureas have that mustine suffix, including carmustine and lomustine. Just think of a Mustang, a wild horse, though more of a wild man horse in this sketch. To remind you of streptozocin, a naturally occurring agent in this class, we've made one of these nitrosocentaurs embellished with streptozocin stripes. All of the nitrosoureas require biotransformation via non-enzymatic hydroxylation in the liver. Once activated, these highly lipophilic molecules cross the blood-brain barrier, making them useful in the treatment of brain tumors such as glioblastoma multiforme. Cytotoxic agents crossing the blood-brain barrier, though? That's gotta be associated with some kind of CNS toxicity, right? As this last nitrosourea centaur here rears up and grabs his head in anguish, keep CNS side effects in mind, including convulsions, dizziness, and ataxia. Well, it's smooth sailing from here, so I think it's time to sum up this epic poem into a few important points. This is an alkylating odyssey, of course, so remember that the agents in this sketch alkylate DNA, causing crosslinks, thus bringing a halt to DNA synthesis. These drugs are cell cycle non-specific, no cell phase to memorize here. That cyclophosphamide cyclops, remember that it's awakened or activated even by a few well-placed CYP450 enzymes. Watch out for bladder cancer, SIADH, myelosuppression, and gonadal toxicity. Hemorrhagic cystitis isn't your thing? Protect your patient with that Mesna maze. Want to really deplete bone marrow? Just follow that sweet busulfan siren song. However, prepare yourself for lung toxicity and that classic busulfan tan. Lastly, the nitrosourea centaurs. These mustine mustangs can penetrate the CNS, making them useful for treating brain cancer. Watch out for CNS side effects. All right, Ithaca's in sight. We made it. Now, if you'll excuse me, I've got some suitors to murder. What are you doing? Whoa! Set down the windbag, okay? Just back away from the windbag. Think about what you're doing here. Everything is going to be just